Let's put our hands together again for the Health Impact Partners. Jonathan.
Thank you.
Pleasure meeting you.
Thank you. Me too.
Thanks so much. Thank you.
All right, let me just start with some numbers. All right, let's try that. Let me start with some numbers. West Oakland has approximately twice the number of asthma hospitalizations as the rest of Alameda County. And that's not good because Alameda County has about 20 to 25% more asthma than the rest of the state. African Americans in West Oakland live about 12 years less than white folks in the hills of Oakland. All right? People living near the railroads in Oakland die more frequently from cancer, from heart disease, from stroke, and from respiratory disease. So that's our starting point. It's facts like these that made the public health community in Oakland concerned when we heard that there was a plan to bring coal through. Right? So we formed what we called the Public Health Advisory Panel on Coal in Oakland. The panel was made of 9 of us. We had truly extensive backgrounds in public health, and we worked together as volunteers. One of my co-panelists, Heather Kuiper, who led the effort, is up here with me, and another, Jan Kirsch. Dr. Jan Kirsch is in the audience. We had 3 medical doctors, 6 PhDs. We had experts on air pollution. There's Jan. We had experts on air pollution, on climate change, on environmental health, on epidemiology. And so we wanted to answer these questions. Will transporting coal through Oakland help or harm the health and safety of Oakland residents? Will it make those statistics for West Oakland better or worse? Right? Worse is the right answer. What we found was that if we decided to transport coal through Oakland, not surprisingly to you guys, air pollution would get worse. And that has tremendous impacts on our health. Right? We also found that the promises like coal covers are vaporware. You can't do it. It doesn't exist right now. Right? So all these mitigations they're talking about won't save us. They won't reduce the amount of exposure to air pollution. We also found that there are other dangers to transporting coal, like catastrophic explosion and climate change. Burning coal in Oakland and burning coal in China is going to lead to global warming that is going to affect Oakland residents. And the people that would be most affected, we found, were the residents of West Oakland that are already facing these incredible inequities. Right? So basically what we found, there's no safe way to transport coal through Oakland. Right? It's going to hurt us. So together, how did we get to this? Together the panel reviewed the evidence that was submitted to the City Council. We also reviewed scientific articles, professional and press reports, and government data. We conducted original calculations. We released a report, gave it to City Council with a 150-page report with 1,000 footnotes in it. All right? Very well referenced. After we had that report, we sent it out to other public health experts. They agreed with us and they endorsed the report. Those folks include former county and state health officials, UCSF professors, and doctors from Children's Hospital. Alameda County Public Health also read the report and sent a letter supporting it to City Council. The role of government should be to create the conditions for good health and well-being of the people of Oakland. It's fair to say that the public health community is in complete agreement. Transporting coal through Oakland would be bad for people's health in West Oakland and in all of Oakland.